Good afternoon and good morning. This is the 1628th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Neha Kakkar. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, a local language session in Malayalam. All these sessions are going in a big way, and we are able to connect with doctors from different part of the world, and already doctors and eminent personalities from 65 countries are present at different subjects in this platform. And we were able to upload many of them in the YouTube. You can search YouTube at IFPH Homeopathy so that you will get previous videos of the same, and we will be uploading today's videos tomorrow itself so that those who missed the session can watch it again, and you can share it with your friends without paying any money. And the purpose of this forum is to take homeopathy to every home around the world. And this is all about the introduction. And let me come to today's guest. As you all know, it is none other than our Dr. Neha Kakkar. She has completed B.H.M.S from Delhi and is a currently practicing homeopath. She has her own clinic, and HOMEOCURE and Care Clinic, Meerut, Uttar Pradesh, India, and one of the chief moderator of IFPH webinar and members of Meerut Homeopathic Medical Association. She is a member at Red Cross Society, Meerut, and the South Delhi Homeopathic Association. She has various presentations on different subjects at different forums, and particularly she has made some of the brilliant presentation in this forum. And she has presented a session on the topic of cancer, its homeopathic etiology and management at All India Homeopathic Congress held at HAT Center, New Delhi in December 2023. And today, Dr. will be discussing about homeopathic management of acute and chronic fevers. As you all know, this is the present situation is full of fevers, and since the climate is unsteady, we are getting different type of fevers. And Dr. Neha Kakkar is an able person to tell what is how a homeopath can conquer these kind of fevers. So we proudly welcome Dr. Neha Kakkar for this session. Welcome, Doctor. Please, I shall make it. I shall make the co-host. I told that. Okay.
Yeah, thank you, Dr. Ganesh, for the wonderful introduction. And it has been a wonderful journey for me for being associated with IFPH for such a long time. And every day I learn new things while moderating and also while presenting. And I thank the IFPH and Dr. Ganesh especially and Dr. M.K. Sahani sir for giving me the opportunity to moderate and also to present on different topics. So it had been a as I've told, it had been a very wonderful journey, and it's a constant learning process. We learn new things every day. So the topic today we are going to discuss is a very easy and a difficult topic also. Fever, I mean, is a topic like it's very easy to treat fever, but it is also very difficult to treat fever also. It's both the cases because sometimes we come across such cases which are very apparently easy to cure, but when we start seeing the case, it's very difficult to diagnose the medicine, what the homeopathic medicine we need to give to the patient. So, and I'll be sharing some cases where because of these cases only, my belief in homeopathy grew manifold after treating some acute cases of fever. So today I'm going to share those cases with you. So let's start our presentation. Okay, is my screen visible?
Yes, it's visible.
Okay. Yes. So homeopathic management of acute and chronic fevers. So now we'll first see what exactly is fever. Fever, as we know, is a temporary increase in body temperature due to the body's immune response to any specific antigen or foreign substance which is causing harm to the body. Whenever an external stimuli or foreign substance attacks our body, the body responds by producing certain antibodies to that antigen or foreign substance. And this, whenever a person is having fever, because the fever is the indication that your immune system is a healthy one, it is producing some antibodies, it is reacting, it is in reactive state. So whenever the body reacts to that external antigen or foreign substance, the person experience a temporary increase in the body temperature, which we know as fever. And secondly, we see whenever the fever is higher, it
Doctor,
should.
your screen is on the first part itself. Please open it.
Okay. Now.
No, it's stuck. It's stuck on the first page itself.
Okay.
It's
I
not
don't know what's the
moving.
problem. I'll just start
Yeah,
share again. Yeah.
share. Yes.
Now is it visible?
Yes, yes. What exactly fever is?
Yes. Okay. Now is it okay?
Okay, you can go ahead.
Yes. So, as we know, the fever is the temporary increase in body temperature because of the body's immune response to any specific antigen. And as I said, the higher the fever, it shows that the higher the infection is there, and the body is fighting vigorously to remove the infection from the body. So, fever isn't like an indicator. It's like a red button mark or a red light, which shows that our body is reacting. It is producing antibodies to the external influence the person is exposed to. Now, there is a similar condition to fever, which is known as hyperthermia. So, what exactly is the difference between the two? Fever, in fever also we see that there is raise in the body temperature, and in hyperthermia also the body feels warm or hot, and the body's temperature might also be shown in the thermometer as high. But this hyperthermia is due to certain external factors like excessive heat or exercise, or due to extra layer of clothing, like when we are wearing extra clothes during winters, or excessive heat is produced in the body during exercise, then also the body's temperature is raised, and that condition is known as hyperthermia. And that hyperthermia is naturally brought down when that external factor or stimulus is removed. Whenever we get heat to the body, who is experiencing some cold or shivering thing, the hypothermia comes down naturally. Or whenever we stop our exercise or extra, whenever the body is also in stress or in fear also, we see the body becomes hot because of the fight or flight response which occurs, that also leads to hypothermia in certain cases. So whenever the extra stimulus is removed, that hypothermia comes down. But in fever is mostly due to any internal cause like infection, inflammation, or malignancy, which bring up the body's temperature, and it does not come down to normal without any external medication. So this is the basic difference between hypothermia and fever. Now let's see what has been the evolution of fever. Fever has been, the primary, like we say, the initial disease which has plagued the mankind since ages. Because whenever the person encounters any kind of infection, fever is the first symptom or the first marker or indicator which shows that something wrong is going inside the body. So fever has been in like a intrude to the humans. So what causes exactly fever? So according to our evolution, we can see that the old culture cited fever as a supernatural phenomena, like with other diseases also, and used prayers and other spiritual practices to ward off the fever. And in some civilization, fever was also considered beneficial for the system, and no medication was used to bring down the fever. We are living in an age where we constantly use many antibiotics and many medications to suddenly bring down the fever. But previously, in many cultures, this was not the case. Fevers was considered beneficial, and that fever temperature was raised up to a certain threshold level, and the infection was naturally expelled, because as we know that fever is the response which we are getting from the antibodies. So fever was considered beneficial, and uh, no medications was used previously. But this had a disadvantage, because in certain cases, because of high fever, the person leaded to even the death of the patient, or some very complication like sepsis or other septic shock, and all those things used to occur. But it was both beneficial and not very good, not yielded very good results. So this kinds of mixed response were there previously. But now, as the scientific mind developed and the critical thinking came into action, antibiotics came, as we know now, and many theories is revolved as to why certain plants and herbs warded off fever. Obvious example is of that cinchona bark of which Dr. Henneman used as a first tool to discover homeopathy. So we see that how evolution has taken place from being very skeptic about fever, where prayers and other things used to use, and then slowly we used herbs and certain plants and herbal medicines, and now we are using a lot of modern medicines and many chemicals to ward off the infections, and also uh, to decrease the hypothermia or the fever. But so we see that this part is also having certain advantage, because high fever can also weaken the body's immune system and cause vital drain of the body's energy level. So this also has its both pros and cons, the present system, because we see we have to break down the fever in many cases when the fever is very high. But on the other hand, we have to, sometimes we should also wait and see, because sometimes that reaction is very necessary for the body to ward off the infection. So the both ways, this the present scenario is both beneficial, and also it has certain disadvantages. Now, what is the classification of fevers? We see fevers can be classified based on different criteria. That is, first criteria is based on the mode of onset, how the fever is starting and what a time period is taking. That's the mode of onset will decide what kind of fever it is. Then we have based on pattern or relapse of fever, how quickly the fever is relapsing or coming back, and based on the temperature range, how high the fever is going, and based on origin of fever. So on these four criteria, we'll see the classification of fevers. So depending upon the mode of onset, we have acute fevers, where we see sudden rise in body temperature for only a short period of time, when we have 103 or 104 or 105 or 6 degree centigrade coming up for 1 or 2 days, and very high spike in temperature. That is the acute phase of the fever. Then we have the subacute phase that lasts longer than the acute fever. It may vary from 3 to 4 days. Then we have recurrent, that is, it is occurring at regular interval or follows a specific pattern. Then we have the chronic. Obviously, it's lasting, when it's lasting for more than 2 or 3 weeks, then it is said to be in the chronic stage. So we have these four stages, where we see acute, subacute, and recurrent stage, and the chronic stage of fever, depending upon the mode of onset. Next, we see classification of fevers depending upon the pattern and relapse, how quickly the fever is coming back. So first we see intermittent. Now all this classification based on the relapse might overlap sometimes. These intermittent, remittent, and relapsing fever sometimes overlap each other, because they have very little differentiation in between them. But still we need to classify based upon these things. Intermittent fever has periods of normal body temperature which alternates with episodes of fever. There is a time period where the body is having certain fever like 101 grade or 102 grade, and then after the fever goes down, there is a normal body temperature for 3-4 days, and again the episode of fever comes back. So that is called intermittent. Remittent is body temperature remains high and then becomes low, but does not touch the normal grade. The fever is not touching the normal centigrade or the Fahrenheit, that the normal grade of the temperature. It just goes on and it comes down, then it goes high again. That is remittent. Then we have continuous. Obviously, the name itself suggests the body temperature remains above normal without variation for more than 1 degree Celsius in 24 hours. Then we have hectic, which is associated with a lot of chills and sweat. Lot of chills. And obviously in homeopathy, we have a whole chapter on chills and sweat, where we have different specifications, where we take in account of chills and sweat along with the onset of fever and all other concomitants. I guess no other pathy in the world have this variation and this detailing of fever as homeopathy does, based upon the chills and sweat things. Then we have the relapsing fever, which continues for several days, followed by short period of normalcy. So as I said, this relapsing and intermittent seem to overlap each other, but I don't know, for the sake of classification, we have these 5 kinds of classification of fevers depending upon pattern and relapse. Next, we see classification based on the temperature range, where we see low grade fever, obviously from 100 degree to 102 degree, moderate grade from 102 to 104, and high grade from 104 to 106 degrees. Then we have hyperpyrexia, which is an clinical and medical emergency, when we have fever more than 106 degree, where we can see a very high rise of temperature and complications like sepsis or septic shock, or even cases where the brain also start getting involved, and there are delirium and psychological symptoms start coming up in this kind of thing. So this is kind of hyperpyrexia is a medical emergency. Other are very clinically easily managed with many antipyretic, and obviously with homeopathy also. So next we see classification based on the origin. Now the origin, how the fever is getting inside the system, that the cause, the causa mobile, which we say, what is the exactly the cause of the fever, where we see in the origin of fevers. First is the infectious fever, which is general infections, which can be any bacterial or viral infection like tuberculosis, typhoid, endocarditis. Recently we are seeing many cases of even like in COVID or in the HMPV virus. So the fever is the basic symptom. Fever can have many infectious causes, and you see other diseases like dengue and chikungunya. So fever is a basic manifestation of mostly all the infectious diseases, even hepatitis, jaundice. So these are the basic infectious causes which can be caused by any bacterial, parasitic, or even viral infection. Then we have inflammatory fevers caused by any inflammatory disorder. That means any inflammation or any inflammation like rheumatoid arthritis, lupus, or giant cell arthritis, or any kind of inflammation like even in lymphadenopathy. These kinds of it also leads to raise in the body temperature and hyperthermia and fever symptoms. Then we have drug induced fevers, which can be caused by certain medications such as antibiotics or any sulfur medications, even steroids and antipsychotics. Obviously, as we said, fever is a reaction. So that reaction can be induced by any infection, anything that is causing. And obviously, inflammation is the basic part which is going on. Inflammation means there is a fight that is going on. The body is fighting and it is producing certain cells which is increasing the body temperature. So these 3 causes can lead to fever origins. So I guess this is very clear. Depending on the mode of onset, we have acute, subacute, recurrent, and chronic. Then we have pattern and relapse, intermittent, remittent, continuous, and hectic. Relapsing and intermittent seem to overlap each other. Then we have low grade, moderate grade, and high grade and hyperpyrexia. And then we have infectious, inflammatory, and drug induced fever. So this is the basic classification of fevers which we see. And now we see what exactly is happening inside the body in a fever. Whenever any pathogen or pyrogen or any external influence or even any inflammation or toxin that is entering in the body leads to release of any immune response mediators like interleukins 1 and 2. These are certain type of cells which are produced by the WBCs, like that is the white blood cells, which is the the army of the body. So they produce certain pyrogenic cytokines. Pyrogenic means they are fever producing cytokines which send signals to the hypothalamus and which produces a neurotransmitter called prostaglandin E2. So this is the neurotransmitter that is being released from the cytokines reaching the hypothalamus, and that neurotransmitter is then further raising the body's temperature from normal to leading to a high point temperature, which is called as fever. So this is the pathway we see in the fever pathophysiology. Now, so one thing I want to say here, which I have not mentioned in the slide, that how homeopathy is acting here is of a thing to know, because in research we need to prove this, that how the body cells are producing cytokines and at what level exactly is homeopathy. As we say in general name and terms, that homeopathy increases the immunity of the body naturally. So this is my obviously many research work is going on, and obviously we see, I hope in future we see that this things get proved, that the level at the pyrogenic cytokines, we see the cytokines, there is a level of increase in cytokines level, which leads to the stimulation of hypothalamus and ultimately to prostaglandin release, which raises the body temperature. Because this is the area which we see, the WBC is the area where the homeopathy medicine can increase, because it is all about increasing the immunity, natural immunity of the body. Homeopathy is all about natural increasing the immunity. So this is the area where the homeopathic medicine works, and I hope this will be proved in future, where we can see exactly how the homeopathic medicine is affecting this pathway to decrease the fever in a patient. So obviously we have a lot of homeopathic medicines for fever, and some common medicines which are used, I've just mentioned some of them, are aconite, belladonna, arsenic, baptisia, cinchona, basilinum, ferrophos, Brainia dulcamara, apis, gelsemium, tuberculinum, arum triphyllum, Azadiracta indica, Baryta carp, colchicum, eucalyptus, Eupatorium perf, Formica rufa, Justicia, Noxomica. Obviously, the list is endless, as you can use any of the constitutional medicines, but these are the some of the common medicines I've just dotted them down. Any constitutional medicine which is matching the symptom and simillimum will obviously cure the case. So now moving on to the cases, like I said in the start of the presentation, that I am mentioning some cases where, these cases ingrained me that homeopathy can work miracles and can, really be introduced into the mainstream pathies, and we can help in even, in a OPD and an emergency OPDs to bring down the fever. So this was a classic case, this case where the homeopathy really, helped the patient a lot. So there was a child, 8-year-old male child, which was obviously living in my neighborhood, and he was suffering from high grade fever, that is more than 102 °F since 2 days, along with severe cough and cold, and was already taking antibiotics and antipyretics for it. The presenting complaint at the third day, I mean, he was having fever already previous with severe cough and cold, but they came to me at 2 p.m. at night. I was just in the neighborhood, and obviously they were consulting a allopath, but because at 2 p.m. at night the child complained of high grade fever, he was very much restless, and complained of remitted vomiting and fever not coming down with antipyretics also. There was high grade fever, the fever was 103 °, and there was remitted vomiting. Lot of vomiting was there. Child was having vomiting of mucus along with undigested food material. Even water intake was disagreeable and was vomited by the patient. The fever was not coming down even after 2 hours of taking antibiotics. The patient was repeatedly vomiting. What getting ingested was coming out. The medicine was also not staying inside. So obviously the fever was not coming down. Due to the repeated vomiting, the child was having excessive drowsiness, but was tossing and turning in the state. He was very much restless, and he was almost coming to the state of drowsiness. That means the fluids were so much out of the body that the brain was also starting to get affected. The cheeks were also reddish in hue. At 2 p.m. night, the parents consulted me for the boy, as they were growing anxious due to the child condition of drowsiness. Obviously, they were very worried that where should they go at 2 p.m. at night, and where should they go and take the child, because so they just knocked and called me up. And after carefully observing the boy and seeing the high grade fever with mental restlessness and physical exhaustion and inability to even digest water only, even water was getting vomited there. only one medicine that came into my mind, that was arsenic album. I took 10 drops of arsenic album 200 and dissolved in half cup of water and gave 1 spoon of the dissolved solution every 10 minutes, finishing within half an hour. Within half an hour, the half cup of water of medicine was finished. After every 10 minutes, the dose was given. After 1 hour of the medicine intake, the boy's temperature returned to normal and vomiting stopped. The boy slept well for 8 hours. So the whole night went very silently, which was causing much grief to the parents and obviously to the patient. The temperature was brought down within 1 hour of the medicine. And the next cycle of fever was also less in intensity. So we see how quickly homeopathy worked here with just the basic symptom of restlessness and physical exhaustion, the classical picture of arsenic, and even water was disagreeing. So this observation obviously is needed by the doctor, and we need to be confident for ourselves that we can take such cases and bring them to normal with homeopathy. Thus, we see that in acute fevers, the observational skills are very important, and how homeopathic medicines, when based on right simulatum, can produce marvelous and quick result. So this was a classical case of acute fever coming to normal. Next, we see where we see a second case of acute fever, where a 20-year-old female came into the clinic with complaint of sore throat and high fever since the previous night. The patient had taken, obviously, she had taken some outside food the previous night, had excessive sticking pain on deglutination. On examination, obviously, the throat was very bright red and the whole throat was congested. Fever ran up to 104 degrees Fahrenheit. She did not have any chills with fever. Thirst and appetite was normal. Otherwise, had a robust constitution with seldom getting fever. No specific mental illness. Obviously, the basic condition here was the throat pain was very excessive, and she was not even be able to drink in water and consume any food. Patient was given 3 doses of basilinum 200, 3 doses first. Obviously, whenever there is an outside infection, or whenever there is a stomach infection due to outside vendors eating, I as a rule give always nux vomica. And whenever there is a throat problem or a cold and cough after getting exposed to eating outside food, or fever coming on after eating outside food, or any cough coming up, so basilinum 200, this I learned in my college days from my senior, that you need to give basilinum first and then further proceed the case. So there I gave basilinum 203 doses first, and then high grade fever along with congested throat and pain while swelling, I decided to give medicine in a way that her throat and fever gets healed without much hurt to her. So after giving basilinum, I have a unique way of giving medicines to patients who are having excessive cough and even throat pain, where I give biochemic medicine. Biochemic medicines like ferromphos and even calimure 6x were wonderfully in these cases, along with belladonna 200. It was given, dissolved in 1 cup water, and I made her to gargle the medicine, and then the medicine was swallowed. When you gargle and mix the medicine, that infection gets clear. It works like, you can say, allopathic betadine here. So ferromphos 6s along with belladonna, that cleared the infection very well, and gargles were given after every half an hour interval for 2 hours, and to be repeated 2 times a day. So within the next day, the patient came better with 80% relief in throat pain with almost no fever. Even when you see throat infections and coughs coming up, obviously the allopathic doctors prescribe antibiotics like amoxicillin and azithromycin. So that too takes around 3 days to come up. And now here we see how homeopathy works for, and this medicine, this way of taking medicine where we gargle the medicine has given me wonderful results in many of the fever cases where throat symptom and cough symptom predominate the case. So this you can take it into consideration, where you can use them as a gargle medicine also. So these were the 2 acute cases of fever which worked very wonderfully through the medicine of homeopathy. Now we are coming to the chronic cases of fever, where we had a 45-year-old female patient with in December 2021. She came up with complaint of tiredness and general malaise along with low grade fever coming up every evening, every day since the past 6 months. Fever usually hovered between 99 degree to 100 degree Fahrenheit. She was taking allopathic medication, which included mostly multivitamins with occasional intake of antibiotics to relieve body pain and general malaise. More concomitants included headache at commencement of fever. So there was a very low grade fever, but there was a lot of malaise and you can say body pain and malaise was the characteristic symptom here. The fever was not much high grade. It was only from 99 degree to 100 degree. History of typhoid 10 year back. The basic symptom which I came to know about was that history of typhoid was there 10 years back. Family history of blood pressure, diabetes in mother and father both. And in the gynec history, we see that 2 children were born of normal delivery. Periods were normal, had leukorrhea, but had a leukorrhea issue which stained the underwear yellow and was quite offensive. So the leukorrhea was a symptom here, which she said that herself, she mentioned that there was a lot of leukorrhea and was profuse leukorrhea and was very offensive in nature. Coming to appetite, it was decreased, did not eat well as hunger was not optimum. So obviously, the hunger was affected here. Thirst at regular intervals for large quantity of water, urine and stool were normal. Perspiration very offensive on feet and armpits. Sleep slept on abdomen, dreams were not specific. Brooding nature, coming to mentals, she had brooding nature, used to overthink over troubles and also about her fever condition. But she got angry seldom. So on physical examination, tongue was flabby with offensive breath. So we see offensiveness running through the remedy, where we see locaria was offensive and the tongue was also very flabby and large tongue with a lot of offensive breath. Obviously, I checked the tongue and found the offensiveness of the breath. The patient will herself or himself will not say that my breath is offensive. When you examine the patient, you get to see that there is offensiveness in the breath. Even the discharges which are coming, like even in a lot of cold cases we have where the infection has increased up to bacterial infection and the cough gets yellowish in color, like in kali bichromicum or and creosote we see. So there, whenever you examine the patient, you see that offensiveness coming up because there is destruction of the mucous membrane. So this offensiveness is a character which the doctor himself or herself has to see and see while examining. The patient will not himself convey. So investigations, I recommended their Vidal test was negative, but could be a carrier. I had past history of typhoid fever. Obviously, so we see that in previous history, she had history of typhoid fever 10 years back. And since then, she was, not obviously not up to the mark. She had, regular malaise and tiredness system. And this fever had stumbling her since then. But obviously, she did not consider it as a major thing. But sometimes she used to think about the fever that it might cause her problem. So she came to consult about it. So the past history of typhoid, suspected typhoid carrier, offensiveness of discharges like urticaria, sweat and saliva, appetite was discreet, malaise and headache with fever. All the rubrics I came into account, and obviously I selected baptisia as the remedy because baptisia is a basic typhoid and chronic fever remedy where we have low grade fever with offensiveness running through, and malaise is a characteristic symptom there. So treatment started with Baptisia 30 given for 1 month, followed by Baptisia 200, which gradually improved all the symptoms. First symptom to go away was the offensiveness, because offensiveness is the characteristics of Baptisia. So this offensiveness was the first symptom which was reduced obviously, and which was very much visible because whenever I examined her, the offensiveness was much less. The fever went away completely after 4 months of treatment. However, appetite was not improved and weakness and malaise remained. For that, China 200 was again prescribed for 2 months, which completely cured the patient. So baptisia along with China both are typhoid or chronic fever remedy which worked wonderfully in this case and relieved the patient of a symptom. Now, coming up to the last and the fourth case of a chronic fever, where we see again a female patient who was 30-year-old, visited in March 2024 with complaints of polyarthralgia. The main symptom here was polyarthralgia. She had pains in her finger joints, elbow, wrist, and back. She also had associated complaint of fever and strep throat coming every month. Complaint started 1 year back, and since then had been on painkillers and antipyretics because pains were very severe at night and also on waking in morning. So the basic complaint here obviously was the pain, but fever was the accompaniment here. And obviously we can guess around that this kind of condition was pointing towards like a rheumatoid fever. She was advised to avoid long work hours, but the family condition could not allow her to take adequate rest in spite of the excessive pain. The pain modalities, as obviously the pain modalities need to be considered, was aggravated at night and on exertion, better by warm applications. In past history, patient had taken medicines for me for condition of nail infection. She had fungal infection in the nails and was cured for that. Obviously, some medicines like natrium was given there, and she was completely cured of her nail fungal infection. Family history had mother had rheumatoid arthritis with polyarthralgia and was on steroids and painkillers. So she had a positive history of rheumatoid arthritis running in her family, with her mother having the same complaint, and she was on steroids and regular steroids and painkillers. But here she was only 30 years old and was complaining the same symptoms of fever and polyarthralgia. In physical journals, the appetite was normal, thirst was decreased, drank very little water at a time, desire for fried food, aversion nothing specific, perspiration was scanty, urine normal, stool normal, sleep could not sleep sometimes due to excessive pain. So the pain was so disturbing to her that she could not even sleep due to this pain, and dreams were not specific. Mental journals. So now this case had mostly the basis were of the complaint was mentals, her mentals. The physical things were not pointing out to any specific remedy, and the mentals were also found out later after later in the case. Initially, no mentals were found as the patient did not divulge any specific complaint. She was only concerned about her pain getting relieved. But later in case she opened up, she was a sister of two brothers. One of the brother was unmarried and other married. The girl had to work a lot right from her childhood. Her mother was ill due to rheumatoid, so she was unable to express her feelings openly and felt very bottled up inside. So this symptom came up later in the case. Also, after her brother's marriage, her sister-in-law, that is Bhabi, was also not very keen to take responsibility of the household chores. So she was the one who was always handed over all the responsibility and to do a lot of work. So a history of suppressed emotions came up, and she had a lot of remorse and anger inside her due to her life space. So this thing came later up in the case, and on uh, this formed the basis of the case here. Mentals form, obviously in fever we need to see other physicals, like I said, chills and things, obviously, but whenever there is no physical, the mentals help us to take up the case and clear the case. So her hands were blue many times on the plantar side, blueness faded and came back sometimes again. Rheumatoid, but was negative here. The blood test came out, gave the negative test, but obviously the picture was coming up as a rheumatoid only. Initially, the treatment started with placebo only and advised her to take the painkillers and antipyretics for some time, as hold of the case was not clear. So I told her to continue the condition because the medicine was not coming up clear, and placebo was only given. But still, even after placebo, the patient said that I was a bit better. But later, obviously, the mental picture got clear. The remedy that came out was that of staphysagria. So as you see in the initial list of the medicines, we don't see staphysagria in any of the fever as a fever remedy. But because of the mentals, we see that staphysagria was coming up here. Pains aggravated at night, pains better by warmth, and ailments from obviously better from suppressed emotions and vexation. So this formed the basis, and on the basis of that, staphysagria was chosen. Started with staphysagria 200 given for 2 months, but no relief of symptoms. So 200 gave no relief. Against staphysagria, 1 m was prescribed. 1 m gave her 30% relief of pain and fever symptom. Sore throat was also better in 2 months. Staph 10 m was prescribed, which brought about 70% relief for pain and fever. So here, obviously, the initial potency of 200 did not give any relief because of the mentals predominance in the case. 1 m and 10 m gave her much relief to the symptom of fever, and even the sore throat and the polyarthralgia symptoms was better due to staphysagria here. So this was the chronic case of fever which I mentioned here. And so we can say that homeopathy can very effectively manage both an acute and chronic fevers, uh, according when we select the medicine according to the simillimum and obviously the correct physical general and mental general. I guess I don't have a more to say here today, and thank you very much. Yes, my session has ended very early today.
It's really an excellent session. And just like 2020 cricket, you just went, you just run like anything to clear the session as early as possible. But unfortunately, people were running and want to know more about these cases, because all these cases were presented in a short way, but all the cases were brilliant also. What you saw here is that even in a different situation, we can take only simple medicine, whether there is no specific for any fever. That's what you have shown in all the medicines used in different cases were different. And in the last case, you selected Saphsagria and you won the case. And that's the beauty of homeopathy. As we know that fever is not a simple thing, but it is a thing that makes the worst in the family. Not
Yes.
as far as we used to say, there is nothing to worry about fever. Even without treatment, sometimes fever may go. But nowadays, what is the trend is that the families are just like nuclear family, only one child. So even sometimes when the fever get into a child or a person in the family, the other person will be much worried about it. They were the present.
Yeah, obviously the excessive use of antipyretics,
Yeah,
it's a kind of concern because obviously it is damaging the liver and kidneys of young children today nowadays.
absolutely.
So the
Yes.
homeopathy works very well there, and in mostly in acute cases like that child case, ingrained me the faith of homeopathy because whenever you see acute cases getting treated with homeopathy, so we can use them very effectively. And obviously we should not, even as a homeopathic doctor, you should not jump like if your patient is not getting relief, that you should immediately take up any antibiotics. You should wait for the medicine to work, and obviously the results will be there.
Nowadays, what happens is that most of the families, even from the government sector, medicine, paracetamol is giving to all household, so that they are keeping and they are taking this medicine even without prescription. So, as a result, what happened is that some of the fevers were suppressed in a worse condition. And
Yes.
when the patient visits to a doctor, it may become a pathetic infection. That may be the reason. But if a patient visit to a homeopath, definitely we can manage with the simple medicines. Anyway, it's the time for discussion. I invite all of you to participate in the discussion, and those who want to have a question or want to talk to Dr. Neha Kakkar may raise your hand so that we will allow you to unmute yourself and speak to Dr. Neha Kakkar. So Dr. Indani Bhavadkar is already there. Uh, Please unmute.
Yeah, can you hear me, Dr. Kakkar?
Yes, 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 sir,
Yeah.
please.
Thanks for your excellent presentation. The Staphylococcus case was a new learning for us because we
Yes,
approached from a mind point of view. It was
yes,
really good because the physical journals never had a fever mentioned in any book for this drug. Okay,
yes,
only two practical questions come to my mind. They are very small.
yes.
What is the role of homeopathy in febrile seizures?
Okay, in febrile seizures. Obviously, febrile seizures is, it's kind of a, we can say a medical emergency like thing, where you need to immediately, you need to bring down the things from there. So we have, I guess, a lot of medicines where we can see belladonna coming up because there are a lot of head symptoms in belladonna. Personally, I have not seen any cases of acute febrile seizure cases, but I guess belladonna and medicines like even gelsemium and other medicines can work there. And based upon the seizures medicine, we can say um, absinthium mother tincture works very well in certain seizures. So if we give a complementary these medicines with the obviously the basic symptoms of fever, whatever the presentation is there, clinical presentation is there, and which remedy is coming up in the symptom, we can use those medicines. And belladonna is the basic, and I guess gelsemium can come up. Obviously, when you have practical knowledge, that gives a more of advantage, and those cases give you a lot of. So personally, I have not seen any febrile seizure cases.
Okay. Like, yeah, like Dr. Dhanesh sir mentioned,
Yes,
actually it is very common in pediatric cases, febrile seizures, and
yes,
everyone gets panic, so they keep paracetamol with them. That is there.
yes.
Exactly. Now, secondly, when should a homeopath refer a patient of fever? Can you give some guidelines?
Should get obviously if you have any acute cases of fever, and personally whenever I get an acute case of fever, and if the fever is not coming down after 3 or 4 days, I usually refer to the, because we need to see the anxiousness of the patient parents also. Sometimes they get so anxious that, oh, the fever is not coming down, it's not. So in cases of acute fever, when there is a high grade fever of more than 104 or 105, I wait for 3 days, and if I see the medicine is not working, after that I refer them. Obviously, in chronic fevers, we can wait and watch and see if the medicine is not working. We can raise the potency and change, and we need to use certain. Like I said, role of biochemics is very good in chronic cases also, like ferrum phos, even natrum sulf, where liver is involved. You can use those medicines, and we can use ferrum phos, kali muriaticum. Even in certain anemic conditions, you can use calcarea phos and calcarea's group as biochemic supplements. So those things can help obviously in chronic cases, but in acute cases, we need to consider the things that fever should not go above 105 degree, and it is causing, like you say, these febrile seizures can come. So obviously, to remove that risk, we need to trust our pathy for 2 to 3 days, then we can refer them to the
Yes,
doctor.
I would
Okay,
like
I
to.
don't know when should we
Yes,
change the remedy? Like homeopath should change a remedy after how many doses?
That's a very tricky question, because every homeopath is his or her own perception. Obviously, some doctors, change. You can change from morning to evening. You can change 2 3 medicines, and some obviously wait for the medicine to act. But in acute cases, we can play our medicine. We can use, like if you have given a dose in the morning, then you can wait till evening and you can change your medicine, because obviously acute cases need intervention early.
yes.
So
Okay.
that's
Thank you,
my.
madam. Thank you, madam. Yeah.
I would like to add something more on that because actually we all know that the viral diseases is just 48 hours fever may be the normal course, and when usually it will subside within 48 hours in use. But you will have to, if the if he is having some chronic infection, either a patient is having recurrent tonsillitis or laryngitis or sinusitis,
Yes,
fever
yes,
may there may be fever in the evening for some 3 to 5 days more. And
yes,
even thereafter, the fever persists, then you will have to do all the blood tests as well as the other tests.
yes,
Then you can find that if there is any chronicity in that case, and if at all there is any
yes.
complication, then you can correct the medicine. You can just give.
Yeah, obviously, as we say, both ways it is, so we need to be judgmental about when we are using the antipyretics. We should be able to judge that, on the right way. For example, if you're using homeopathy and it's bringing down other symptoms and only the fever is not coming down, so we can play with the antipyretics along with the homeopathic medicine, which is relieving the other symptoms, and the fever can be brought down by the antipyretic. Obviously, the dose should not be very frequent of antipyretics, because sometimes the doctor gives doses like 5 times a day. That dose causes a detrimental effect on the patient. You can just limit it up to 1 or 2 times a day, and then continue with the homeopathic medicine. So that
Finally,
also works in some cases.
Finally, our medicine itself will do the antipyretic work in those conditions
Yes,
because
yes,
we have a remedy called tuberculinum. As you know, whenever there
yes.
is it is not getting reduced or the patient is in a tricky situation, then you give a dose of tuberculinum ornament. Then you can find the right remedy coming out thereafter, and you can go ahead in that way.
Mm.
Fever, It is just like a 2020 game. You will have to use all tools to take the patient to recovery in the shortest possible time that we can do with our homeopathic medicine. Anyway, I invite Dr. Amir Mali from Pakistan to say something more on that.
Hello, greetings, sir. Namaskaram, Honorable Dr. Neha Kakkar. Grants, thanks to you. Your scientific explanation is unbelievable. Very good explanation that fever is a reaction, and the antibody antigen explanations. This is very important to us for the homeopaths. You should explain very well for the next episodes of your lectures. This that I request to you, because very few doctors have good knowledge, a great knowledge, and the selection of medicine is excellent, and the behavior of fever is sometimes different, because this is an emergency situation that we have to control, that brain can be damaged, and fits
Yes.
what should be started. So especially in children's, this is very important, because this is very sensitivity about what is the reason sometimes our medicines give reaction, because after giving medicine suddenly the fever shooted, and after some time it will be subside. What is the
Yes.
one
Obviously, this answer lies in the same thing, like that homeopathic medicines raises the immunity of the body. They are increasing, like I say, I hope that in future research work we are able to see that how homeopathic medicine is acting on that interleukin pathway. So we can say that the homeopathic medicine is raising the immunity. It is increasing the body's WBCs and interleukins, which are fighting more vigorously and increasing the body temperature for a certain period of time, then obviously the fever is coming down. So
and then it
this
will be
also proves that that medicine is working. Whenever we see a aggravation, obviously, just as Dr. Hahnemann has always said, that if we see initial aggravation of the condition, so that is a better indication than the initial, the immediate relief. So if we see that aggravation is coming up and later on the fever is subsiding down on itself, so we can say that the medicine is working on the immunity
exactly
system very well.
very right,
Yes.
very right. Second question, honorable doctor, about the dengue fever. What medicine would you like to prescribe for dengue patients that when they
Obviously, dengue has different manifestation. Like I said, I have I had a case previously also in dengue, where I used ferrum-phos in 200 and also in 6s potency repeated doses along with eupatorium and arnica, and the platelets have increased after that. So the biochemic medicines can work very well in these cases where the platelets are low. And
very low?
obviously many medicines like carica, papaya, mother tincture, that also increases platelets very well in these cases.
Yes,
Yes.
yes,
So,
yes.
and other medicines like Rustox, based upon the symptoms of, polyarthralgia, because there's a lot of body ache in dengue sometimes, and restlessness. Even arsenic works very well in dengue cases when there is excessive restlessness of the patient. So you can use arsenic, you can use eupatorium, you can use arnica, you can use gelsemium, you can use Rustox, and even ferrum-phos in both in potency, 200 and C potency, and biochemical potency. So that works very well in dengue cases, I guess.
One question more, honorable doctor. In the viral fevers, the veratrum viride.
Yes.
Veratrum viride have some different function, that medicine change the blood circulation within your body, so your blood cannot be catch the viral infections. This is a very secret of this medicine. So
Okay.
in pandemics, I think it should be advised. Or have you ever used in this situation for the viral fevers?
I have not personally used Veritrim Viride very much. I have not used it much, but I guess obviously there is if there is the symptoms are matching, and the many the genus epidemicus comes up there. Like arsenic came up in COVID and all other medicine. If the medicines the symptoms are matching, I guess Veritrim has a lot of weakness, and loss of body fluids are there. So if the malaise and weakness is coming, obviously we can use any of the medicine as a preventive medicine which comes
Yes,
up
it's a preventive medicine. Very right.
in those cases.
Thank you very much, honorable doctor. A lot of congratulations to you. Your
Thank
lecture
you.
is
Thank you
so
so much.
beautiful, so nice. You are very hardworking doctor. God bless you
Thank
a lot.
you.
Yes, I really appreciate it, because the selection of medicine is so excellent. I believe you have a very, very concentrated mind, and you have a very strong grip on the medicines and the disease also, and on pathology also. This
Okay.
is to become a good homeopath. It is a very important thing, and I believe you are one of best doctor in IFPH. God bless you.
Thank you so much.
Thank you.
Obviously, there are many more than me. I am just a learner. As I said, I have a lot of things to learn in experience
Yes,
also, obviously. But and IFPH has given me a very wonderful forum for learning.
yes.
IFPH number world organization, and our creators and members are so beautiful. They have do a very good work for the humanity, especially in that pandemic time. You know, it
Yes.
was created in the very worst time in 2020, when the world is suffering a lot of fatal deaths and issues in the whole world. So we love IFPH. We appreciate IFPH, our seniors, our members, our students, all. God bless you, and a lot of love and prayers to you.
Thank you so much.
Okay, okay. Now it's up to Dr. Rambaresh, sir.
Thank you.
Thank you, Dr. Dhanesh ji, and Namaskar, Dr. Amir Malik
Namaskaram,
ji,
namaskaram.
and Dr. Indranil ji, or congratulations, Dr. Neha Kakkar ji.
Dhanyawad, sir.
Very
Hmm.
nice presentation, excellent session, explanation of fever. Fever is a not disease. Fever is a sign of the vital force and body energy. There are two types of disease, acute and chronic. Acute disease, without medicine, expel the symptom. Patient subside या patient death. लेकिन homeopathic medicine is a very good role of the fever. Serum force and viral fever. Pulsatilla is a very good remedy. Viral fever. Any types of fever, homeopathic medicine, acute fever is a very fantastic function of the role of fever. So, very, very thanks, Dr. Neha Kakkar.
Dhanyawad.
Very, very
Yes,
thanks.
yes. As we all know that a homeopathic doctor shall not be a unprejudiced personality when you look at a patient. That's what is the presentation demonstrated in this situation. Because we used to believe that, oh, this is a case of fever, we can go ahead with belladonna. Oh, this is a
Yes.
case but it is not. It
Yes.
can be any medicine that come in as a constitutional medicine. For example, a patient is coming up with very high fever and extremely chilly, and is angry about the others that do. In that particular situation, you require Naxomica, no belladonna, no Rostox, no any other medicine. But in the same time, a patient come to you and trying to you, doctor, I'm not in a position to. I'm very much having pain. I'm here. So in those conditions, and when you started to be consult here, oh, doctor, I'm feeling better. After you take, then in those conditions, we can go ahead with Valsatla. So that is the
Yes,
difference
very.
between homeopathy and the other system of medicine. And when a patient is, oh, doctor, I'm very much tired. I cannot even sit. I go, oh, what is breaking head? Oh, I cannot hold this pain here. That in those conditions, we can give gelsemium. That's the beauty. So no specific remedy for homeopathy and fever. That's what Dr. Neha Kakkar has demonstrated in this forum. And really beautiful day. We enjoyed every bit of the presentation, Dr. Neha Kakkar. You want to say anything more? You can come out and say.
Belladonna, hello sir, belladonna. There are 4 symptoms. Belladonna, bud, चिड़िया, B से burning, I से inflammation, R से red, D से delirium. Belladonna is the suited remedy. There are 4 symptoms. Thank you.
Yes, one of my friend who is a very good practitioner, having a lot of patients, he always begin the treatment of fever with sulfur, 1 dose. So we can see that the patient, sulfur patient is also the redness in the face and everything. So that may be almost all viral cases come up with some eruption and eruptive fevers also. So that may be the reason why those people are starting treatment with the sulfur, but it does not mean that everyone should go in that way. it all depend upon the experience of the physician, and it is his right to choose the right remedy also. Anyway, congratulations, Dr. Neha Kakkar, for such a beautiful session in this evening. I invite Dr. Indrani Pavadkar to say a vote of thanks to the session.
Okay. Dr. Kakkar, we are really thankful to you from IFPH. This is a very difficult topic and you have unfolded it in a very logical way, scientific way. Also, you have presented good cases, 2 acute, 1 chronic, and it has definitely given us some angle to look at the fever cases. So on behalf of IFPH, we all are very much thankful to you and we request you to come once again so as to approach this difficult topic. Thank you for your presentation.
Yeah.
Thank you. Thank you.
I hope I'll do justice again in further forums also, and as a moderator and both as a presenter. And thanking all
Yeah,
of you
thank
for
you.
your support. Thank you so much.
Thank you, Dr. Indrani Bhavkar, Dr. Neha Kakkar, and those who attend the session this evening, particularly Dr. Amir Malik from Pakistan. Thank you all for a wonderful evening. And tomorrow we will have a session from Dr.
Chaliye.
Sadar. Dr. Sadar said, and he will be talking about management of ADHD as well as learning disabilities with homeopathy. With that, we come to the end of the day 1629. Thank you all. Good night. It's over to Dr. Mariam or Dr. P. Shaila to moderate the Malayalam session.